seeing the ophthalmologist or the local Walmart optometrist, I think of, do you have baseline issues? In the trials, it was a stricter, you need a baseline exam, and then, intermittently in practice, again, I think it could vary to some extent between mandating that baseline. If there really are delays in getting it, I don't hold the start until I get that exam, but I usually send them to a specialist early on in their treatment. Other approaches, from other physicians have been, if they're not having any baseline symptoms, you could probably just watch it. If they develop something, make sure to send them. I think depending on your level of comfort there, I'm curious what you do in terms of sending to ophthalmology or optometry.
We actually have in the Beacon order set, we built in, the ocular drops, and we built in, steroid mouthwash for
at least 4 times a day with those steroid mouthwashes also.
And we've had, based on the label, had a little bit of a patient handout that we also give to patients. Every drug we have has a little bit of tiny patient instructions. I don't see it have been an issue with my patients, and most of them are very appreciative, and they understand. You explain what to look for, what we're concerned about, and patients typically do it. When it comes to the eye exams, it does need a little bit of a discussion and making sure that the patients understand what to look for. Make sure that they use their the single-use typically, the ones that are preservative-free, refresh eye drops. I like those that are easy to get. And then, and then being able to, understand the symptoms of dry eye, how that develops, and also any visual changes or any headaches that they might develop. And, I think, again, we just got comfortable a little bit with chemotherapies. We give them a handout of chemotherapy. Hey, you're going to have that. But if you look at chemotherapies, they have a lot of adverse events, and we typically, paclitaxel has eye irritation all the time. So, but it's a thing that because of these are emergent adverse events, and we don't know, how much, how the severity, we'd like to be a little bit extra cautious. But you're absolutely correct. Prevention is key in these agents, and the other thing that I mentioned to my patient that there is still some concerns of LFT elevation, some concerns of myelosuppression is minimal, and but other than that, we haven't really seen any substantial toxicity outside of those.
Yeah, and as you nicely laid out, the patient education is an important part of that prevention, right? Because if they're not informed about these more unique or touch toxicities, maybe they haven't already been aware of, we can provide, we may know how to handle it, but for them to understand the importance of it, I think it's critical. I mean, when we initially started the trials, with Dato-DXd, where we ran into issues with patients is when they were not fully compliant with, the mouthwashes and the eye drops. Once we understood really the critical relevance of that so that we can overemphasize this to the patients, it stopped being a problem. So I think having them as part of the team is important. It was similar with T-DXd, right? With the ILD risk, we saw a much initially higher risk of toxicities and even mortality with the initial reports that came out. But as a community, both as the physicians became more aware and counseling the patients to let us know if you have a cough, if you have shortness of breath, it, I think, improved and really reduced the severity of it. But to that point, this is Dato-DXd is another DXd-based ADC, where it's also important to counsel them, to let us know about those same symptoms, but the incidence of severity seems to be in a different scope than T-DXd, where we're not doing the same magnitude of monitoring that we really require in a lot of our patients on T-DXd, right? Where every 6 to 9 week CT scans, because we do see some of these severe hospitalizations and mortalities every now and then from this drug. But with Dato, it seems to be a little bit of a different beast. I think 3% or so, I think, on the trial had ILD. There was one death, and this is, in a 600 patient or so trial where half were on the ADC arm.